Today we will discuss about visual impairment and ways to cater visual impairment in the classroom. The topics we will discuss today are meaning, types, causes, identification, challenges, and ways to cater visual impairment. First, we will discuss what is visual impairment. So, it refers to a condition where a person's eyesight is significantly compromised, making it difficult for them to perform everyday activities that require normal vision. It can range from mild vision loss to total blindness, impacting one's ability to see details, colors, or navigate their surroundings. Now we will see the types of visual impairments. So, the first type is hypermetropia. It is also known as farsightedness. It's a vision condition where distant objects are seen more clearly than the closed ones. For example, one might struggle to read a book but can see distant road signs clearly. Second one is myopia. It is commonly known as nearsightedness. It means one can see close objects clearly but distant ones appear blurry. For example, one may find it difficult to recognize people across the street but have no trouble reading a book. Third one is astigmatism. This occurs when the cornea or lens has an irregular shape, causing blurred vision as light is not focused evenly. For example, imagine seeing horizontal lines clearly but vertical lines appear blurry or vice versa. Fourth one is color blindness. It's a condition where individuals have difficulty distinguishing certain colors. The most common type is red green color blindness. For example, if someone is red green color blind, they might have difficulty distinguishing between red and green traffic lights. Fifth one is glaucoma. It is group of eye conditions that damage optic nerve, often due to increased pressure in the eye. It can lead to vision loss if not treated. Sixth one is coloboma. It is a structural eye defect present at birth where part of the eye, such as the iris, retina, or optic nerve, is missing. Now we will discuss causes of visual impairment. First one is improper postures adopted at workplaces. Second, eye infections and eye diseases. That, for example, someone has a specific eye infection or a disease, so that will cause visual impairment. Third, transfer of genes associated from parents. For example, if one's parent is visual impaired, then the um, genetic transfer will also cause visual impairment to the child. Fourth one is carelessness adopted by the pregnant mothers. Fifth one, unfavorable conditions, that is starvation and malnutrition. Last, reading, writing, and working in defective and improper lights. Next one is identification of visual impairment. First, complaints of headache, rub eyes excessively. Sometimes child may rub their eyes excessively, so we can identify that they have some visual impairment. Third, becomes inattentive during reading sessions, blink eye frequently, holds objects close to their eyes, and watering of eyes. Next is challenges of visual impairment. First is learning difficulties. In this, the student may read very slow or fall behind than the others. They have the difficulty to meet the demands of general classroom. Second, fewer opportunities to acquire information visually. For example, if we teach the student through maps and art, they have difficulty by learning through them. Third, social difficulties. They can't catch non-verbal cues from others. They have inability to judge, that is, a standing distance between two people. Next, the ways to cater visual impairment in classroom. So the first one is accessible materials. We can provide students some materials in large prints, braille, or digital formats. Classroom layout. The classroom layout may be maintained and organized in an organized way for easy navigation for the visually impaired students. Third, verbal descriptions. We can offer clear verbal explanations or verbal descriptions to the visually impaired students. Fourth, adaptive technology. In this, we can integrate readers, magnification software, or brain displays. And collaborative support. We can encourage peer assistance and involve support staff for additional help. Thank you.